now. The resilience and the mental health of people under the nationwide lockdown due to the COVID-19 have come under severe stress. And the problem of the stress among people is likely to be accentuated, which will further call for the intervention of many mental health specialists. Today, we are joined with Dr. Aravind, who is the Associate Professor at the National Institute of Mental Health and Neuro-Sciences, and Dr. Kim, who is the Assistant Professor of Psychiatric Social Work and specializes in women mental health. Thank you for joining us.
Thank you so much.
Doctors, my first question to you would be, this comes after a sad demise of one of the celebrated people of the country. And it's not just was a loss of fraternity, but this mental awareness comes as a big wake-up call for India. So how do you think someone who thinks that they may be dealing with mental illness but doesn't have the assurance about getting assistance, what do you have to say about it?
For example, when you talk about mental illness as such, let me clarify you. It is not all persons with mental illness will be having a suicidal thought. It is specifically related to a type of mental illness which is called as depression. And even there, not all the persons who are depressed will have the suicidal thought. This might be present in some of the patients with depression. And it's not that persons who are having the suicidal ideation will not show any signs of it. Definitely there will be signs in terms of change in their mood, change in their behavior. For example, the person was very active, they would have got withdrawn, as well as there would be change in their sleeping patterns, the way they talk. There will be a lot of hopelessness in the way they talk, as if they are not good for anything, which people around them wouldn't have noticed 2 weeks back or 3 weeks back or whatever be the time period. So that's the kind of change one has to take as a warning sign, so that a person around them itself can identify this person, as well as a kind of awareness. Each and every individual should be aware of these symptoms. For example, suppose if it happens to me, no matter what I am, like for example, even I'm a mental health professional, even I might get such symptoms in various situations. Only thing is, one has to be aware of it and seek assistance at the earliest. Early recognition will lead to better recovery from these sort of issues.
Also, if we can get a very clear idea, because I believe there's a lot of confusion that people, especially in India, now that it's anyway considered as a taboo, and first of all, at first level, it's not accepted as something that needs treatment. So people do not really know a difference between counseling, therapy, psychiatry, psychology. So could you run through us as to what are the basic differences, so that people who are approaching the counselors or the therapists, they can seek help accordingly?
Okay. Let me answer, and then I will also request Dr. Kim to answer if I left out something. For example, when you talk about the counseling services, treatment from a psychiatrist, let me clarify you that psychological problems or psychological issues are different from mental illness. For example, anyone can be distressed. All those who are distressed need not be mentally ill. The psychological distress could be because of some of the life events. And in some instances, what happens, this psychological distress might also lead to mental illness. When we talk about mental illness, this mental illness, the one who has mental illness will have a drastic change in their mood, in their thought, in their behavior, as well as in their relationship. This is one point one has to know, whether a person is so-called normal or he has mental illness. This is the first point. The second point is, these changes should either be disturbance to oneself or the others. For example, the one who was calm, who's now showing irritability for the last 2 weeks, 3 weeks. It should be a disturbance either for oneself or people around them. This is the second point. The third point is that these disturbances should affect their self-care. That is, their sleep should be disturbed, their appetite should be disturbed, their sexual activity should be disturbed, as well as it should affect their occupational functioning, as well as social functioning. If these three things are suiting someone, probably one has to suspect that they are no more in the category of psychological distress. Rather, it will be a mental disorder. These are some of the three main symptoms of mental disorder, and the causes for mental disorders are very many. Though they talk about changes in the chemical imbalances in the brain, these chemical imbalances are caused because of some stressful situation. So the stressful situation became a social issue, whereas this biological thing is the change in chemical reaction. How that particular person copes in that situation becomes psychological. So generally they call the cause of mental illness as biopsychosocial. So
Okay.
that's exactly, for example, if a person satisfies these three points, they might need little more than the counseling.
Okay.
For example, a person is disturbed because of exam failure, a person is disturbed because of some interpersonal relationship. For them, just a counseling is enough. But if there is a gross change in their behavior, emotion, mood, as well as the thought, which disturb their daily activities, then they are the one who might require treatment as such at all three levels: biological level, that is pharmacological, as well as social interventions by talking to their family members to educate them about the mental illness, as well as psychological support for the person as well as for the family. So this is how we need to differentiate between an ordinary psychological issues one undergoes every day and mental illness as such. I would request Kim to add if there is any more.
Yes. Let me define it this way. I think Dr. Arvind has given a very good background into it. Like, for example, in NIMHANS, we work as a multidisciplinary team. You know, we have a psychiatrist. A psychiatrist are someone who have completed their MBBS and MD in psychiatry. So they are the ones who diagnose mental disorder and who give pharmacological treatment, you know. And then we have the other group like psychiatric social worker like us, and then clinical psychologist and a psychiatric nurse in the team. You know, we work as a multidisciplinary team. For example, as Dr. Arvind rightly point out, someone with adjustment difficulties, you know, like relationship failure or some bullying in schools or some kind of family disturbances, divorce happen, you know, they don't need pharmacological treatment. So that is when the psychology team, the psychiatric social work team comes in picture. You know, we help them in counseling there. And for severe mental health issues like someone hearing voices, having delusions, all those need pharmacological treatment again. I think that is where we draw our line on where, you know, each um, one of us take a stand on.
Okay. Dr. Kim, I would also like to ask you, like, can traumatic events in one's life cause mental illness, or it is just a chemical imbalance, like the way you explained it?
Okay. So for somatic complaints, we broadly, if mental health is mental disorders are divided. You know, we call it one as a psychosis, and the other one is neurosis. You know, so somatoform disorders are multiple aches and pains that a person has, you know, which has more of a psychological origin. You know, and for a serious or a chronic kind of issue, then definitely they need treatment, medicine, as well as psychological counseling, you know, or a counseling that we do. I hope I answer.
Yeah, definitely, definitely. And one more thing, what was prevailing a lot, in fact, yesterday, the feasibility of meditation and yoga. So how feasible it is for severe mental illness? Example for one of the major influencers among in India. So they had a comment: if you find anyone who is dealing with mental illness, push them into meditation and yoga. How I believe meditation and yoga, um, does it help at the initial stage? Is it relevant and applicable for people dealing with severe mental illness? To what extent these two categories help a person?
So,
Uh, Actually, when we talk about meditation, yoga, even physical exercise, all these things are more looked from a promotion of mental health activity. For example, one continues to do this, they have a better positive coping strategies, and during crisis situations, this practice of yoga, meditation, and physical activity, physical exercise, will help them to cope with those crisis situations in a positive manner.
But
Though
doctor,
even in
somebody
places
who
like
is dealing with
yeah,
somebody who is, when once diagnosed with a severe level, people do
mm,
recommend these meditation and yoga as the solutions. So, what do you have to say about those people who have reached a level after
yeah,
being
that's
diagnosed?
what I was about to say. Yeah, see, even at NIMHANS, we have a center for yoga.
Okay.
There, some researches are happening, connecting yoga, meditation, and mental illness, especially depression. And they are trying to, there are possibilities where these activities can calm the persons down. But
Okay.
this is not the one-off activity which will help persons with depression or persons with psychological distress. For example, just by doing yoga and meditation where there is no family support at all, there is a kind of a problem. So as I
Okay.
told you, since the causes are biological, psychological, and social, in all the three ways it has to be addressed. One of the strategy might be getting into yoga and meditation as well as physical exercise, because most of the time persons with mental illness, because of lack of energy, they become inactive. So we, as part of therapy, we need to initiate even those activities. In that way it helps.
All right.
adding on to
Yeah.
what, adding on to what Dr.
Yeah.
Arvind said, I think in severe condition, like severe mental illnesses, the mainstay would be medication. I think yoga, meditation, or physical exercise, which he said more in terms of a promotive methods, or an add-on to the uh, medication which they are taking. Meditation or yoga alone may not help a person with severe mental illness. So it's an add-on to what the existing treatment that they have.
Also, there are a lot of myths that prevail, among us. I would really like you to, our audience, to clear on it. So, it is a myth that someone who has suicidal thoughts, they will always remain suicidal, once it begins. And people with mental illness are suicidal. Am I
It is
audible?
something like, as I always say, it's a
Yes.
suicidal thought. Generally, yes, yes, yes. So suicidal thought is something like a sea wave. A single sea will last for just few seconds, and that's the point where we need to understand how we need to intervene when one gets suicidal thoughts. So that's where we keep providing them the helpline numbers, so that is an alternative for them to cope with whenever they get the suicidal thoughts. And then coming back to your question of, once a person becomes suicidal, he remains always suicidal, is not a fact.
Yeah.
For example, it is maybe they might get those thoughts later stages, but it is not that they will definitely act on it. Because in the first instance where he tried attempting suicide, where he has received interventions, lot of positive coping strategies would have been informed to him. And if at all, if he is in touch with mental health professionals, there are less chances for him to for this particular person who even might get those thoughts often may not be whether persons with suicidal thoughts are mentally ill or all the mentally ill persons get these suicidal thoughts. Not necessary. As I told you earlier, only persons with depression, and that too because of the feeling of hopelessness, they might have this suicidal thoughts and they might act on this suicidal thought also. There are majority of the persons with mental illness may not even have these suicidal thoughts. And then all the persons who are having suicidal thought or suicidal attempt need not be mentally ill,
Yes.
because sometimes it could be because of impulsivity also. You know, most of the time there are some depressive episodes, but people say 15% of the suicidal attempts or the suicidal acts are out of impulsivity. So we need not always connect suicidal ideas or the suicidal thoughts and then the suicidal acts with mental illness as such. Kim, anything you have to add?
uh, I would say it doesn't stay long. There are people who had previously had suicidal thoughts now live happily. So it need not be that it's there forever. Okay, and as Dr. Arvind rightly point out that suicide attempt or suicide ideation is not always linked to mental illness. It could be because of many other psychosocial problems like humiliation being there, sudden breakup, the unhappiness at that point of time, as well as the impulsivity, or the poor coping methods. So these are some of the reasons, not only just because they are mentally ill that they are attempting suicide.
Also, there's another myth, Dr. Kim, that most suicides happen without warning. Am I audible?
Not Yes, not necessarily, because there are many people who gives warning sign to their loved ones, to their friends. They talk about it, or they would have done certain things. Like I have one of my patient who said that he's an elderly man, who said that I have kept my savings in my wife's name. I have preparing themselves for it. Or buying certain medications and keep it at home. So these are some of the warning signs that we really need to look into. There are definitely some who took a decision momentarily and did that, but not all.
Also, I would like your both of your opinion about media. How media has media been able to promote or talk about mental illness a lot or not enough?
Uh, I would say it's not to blame anyone. As I already told you, if at all, if one particular sector is not aware of mental illness, mental health, as well as suicide in the current context, they cannot be blamed. It is we who, mental health professionals, need to create awareness even for the persons in the media. For example, one also needs to understand the difference between mental illness and mental health. Absence of mental illness not necessarily mean one is mentally healthy. As I told you in the beginning of the interview, mental illness has certain criteria.
Yeah.
But if I don't have those things, disturbance in thoughts, emotion, and my self-care is okay, that doesn't mean that I'm mentally healthy, because mental health is defined in a different context. What they say, they again give 4 criteria for one to be mentally healthy. First one is the one who realizes one's own potentials. Most of us may not be mentally ill, but most of us also may not know what are our potentials. The other one is the one who copes with their day-to-day stresses in a positive way. The third one is how much productive the person is, as well as how fruitful about it. And then the fourth one is how much is the contribution to the society by themselves. The more we satisfy these 4 areas, the more we become mentally healthy. And that's what everywhere it is not spoken in the context of mental illness. We need to talk in the context of mental health. how to promote mental health. Even the interventions for mental illness should not only focus on reducing the symptoms, but also increasing the mental health of persons with mental illness. In that scenario, in the larger perspective, media also need to say a lot of things in terms of how to improve the mental health,
Being a
not
little
just
more
talking about
sensitive.
mental illness as such.
Yeah.
Yes.
Sensitive. And then even in terms of reporting of suicide, because majority of the time, you also as a media person, you also might know, as soon as the deaths of these celebrities who died by suicide is being reported in the newspaper in detail, the next few days you can see more suicides in that manner. So it becomes a kind of copycat thing, which is easy. The more you explain about the details, the more the chances for people who are following them to commit the same way. They may be in that verge of committing suicide. By seeing this becomes a clue for them. So what the way the media can report is that, rather than using the word suicide, for example, in today's Hindu newspaper, you can see this particular actor committed suicide was not there. This particular actor passes away. The passes away was the thing they had used, and nowhere they had used the word suicide, or they have not detailed. And if you had seen, it has not come in the front pages, it has come in the last page. As you all know, in the front page news is something very important. So
Yeah.
it need not be, maybe for sensationalizing it, people might do it, but that's not the way, because it affects the larger population in different ways. So that's exactly also see now, Mental Health Care Act 2017 also has decriminalized suicide. So one need not, earlier to 2017, if one attempts suicide and if he is not able to, if he is still alive, he can be arrested because it is a criminal act. Whereas now, after Mental Health Care Act 2017, it says clearly, if a person is attempting suicide, it clearly says that he is under stress. So he should get
All right.
psychological support so that he can get out of it. So these are some of the positive things which has to be given in the media. And whenever the media reports about this particular types of deaths, the media also should talk about how to get out of it. Along with that, the preventive strategies or helplines available, so that people not only read in detail about the way the particular person attempted suicide, but it also gives a way for them to how to get out of it, how to seek help. These are some of the things which will be helpful, and which these are some of the ways how media can be sensitive to in reporting this particular type of cases.
Okay. I would also like to have your input about the stigma related to attached with medications of somebody who is following a certain kind of medication. There's a myth that there's no point of recovering or coming back
Yeah,
to normal once a person starts medications. So what do you have to say about
yeah. See, let me give an example of a physical illness like diabetes. Diabetes is not a curable disease, but diabetes is a treatable disease. Similarly, mental illness is also treatable. So when if I say mental illness is not curable, it should not be taken the other way. It is something like diabetes, it is treatable. With the right medications, people need not get back to the symptoms. And sometimes it is not always necessary for someone to continue the treatment, that is pharmacological treatment. It all depends when this person has started taking the treatment. For example, if the illness has prevailed for 1 year and after that a person has come for the treatment, then the duration of taking medication also may be longer. Suppose if the symptoms are identified early, within 2 months, taking medicines may be shorter. So again, it is something like diabetes. If diabetes is identified early, the treatment modalities are different. Otherwise, it goes to a level of injecting insulins. It's something like it's something like diabetes, even mental illness, and its treatment should be treated. It's not something something different from other things. If we'll start looking at it, the treatment modalities like any other physical illness, 50% of the stigma can be handled. And still again here, the treatment modalities, the reason for taking treatment, if all these things are publicized through media, it will be easy for people to understand the need for taking treatment. Otherwise, they will go to the traditional healers, they will spend thousands of rupees, still they may not get the cure. And that financial problem will cause more problems than the mental illness itself. So that one has to be
I
aware of.
think I think we have an internet little issue here,
Yes.
but you're trying
No,
to say that
we can hear you.
Yeah.
okay. So, but you're saying that the more the media becomes a little more responsible about addressing the issue, that will anyway resolve half of the problems.
Yes,
All right. So, Dr. Kim, I would like to have your
yes,
input
yes,
over
yes.
how now that we are dealing with pandemic, it would lead to more such cases, undoubtedly. So, what do you think people can do at their level? In terms of
Okay.
coping it as well as reaching
Yes.
out
In
to
this
their loved
pandemic,
ones. Yeah.
okay. I think during this pandemic, there are an increase in anxiety, worries, tension, frustration, boredom, or sadness, depression, which is ongoing, because this is a kind of a disaster situation where we are all helpless, locked down in the four corner of the room, no mobility, no peer relationship. So everything is stuck in there, so a whole lot of us gets into boredom or frustration or anxiety, worries about the virus itself, whether I will get infected or if my neighbor gets infected. So these are some of the certain stress which is coming up in many of us. Okay, so at this point of time, the best thing or the way how we can handle this issue, one would be to maintain a routine as much as possible, to have a structured routine where we can have time to do certain hobbies that we do or make ourselves happy, interact with people, not to distance ourselves, to get in touch with people so that the boredom, the loneliness doesn't hit us so hard. So reaching out with people, doing some physical exercises, maintaining our sleep and eating timing. So these are some of the things which we can practice during this period of time. Sir, you
I,
would want to add something? Hmm.
Yeah, it's about that social network which is being broken.
yeah.
But for our advantage, we still have that is technology with us. So we need to positively use the technology, but not spending too much on the screen time. But still we can still keep in touch with people. That itself will be a kind of support for us,
So we should
especially in a
know how
pandemic
much
like
we have to
COVID-19.
spend.
Yes. That's one thing which we can do, so that we don't feel that loneliness what is being experienced by many of us.
Also, I think all these media influencers need to be very, very careful because there are a lot of videos that
Yes.
people put out in content. So, what do you have to say about it? Because they don't have a prior knowledge about the subject. I mean, you can raise the issue and your opinion, but this comes as a generalization. And I believe, now that we have more than 80% of people in social media, they tend to follow and believe what people have to say without any prior knowledge in that subject. So what do you have to say, like how much should people consume that, and referring, should they refer to the second source, should they refer to people who are designated in this field?
I would look at it from both the perspective, that is at the larger macro level as well as at the micro level. When I say micro level, individual thing. At the macro level, let me comment first. I would take the example of the messages being sent in Twitter by a US president. Now the Twitter itself has taken a step of telling people who are accessing Twitter to have a reading about this thing, just not to believe what is being tweeted. That is at the macro level. The agencies have to take proper steps. Whereas at the micro level, that is at the individual level, it is advised that though so many things are around us, it is not advisable to just keep following it. Even in this COVID-19 situation, they say don't look into the media more than twice a day. Because it is filled with information related to COVID-19. They even call it as infodemic. Like pandemic, this infodemic is what is causing more of stress and anxiety. So it is from the psychological point of view, it is advised for the individuals as well as children not to get reliable sources. When we talk about reliable sources, for example, in the Indian context, the website of Ministry of Health and Family Welfare updates the information twice a day, including not only the statistics, also some of the preventive measures. For example, in this scenario of unlocking in the month of June, they have even given the guidelines of what are all the measures to be taken by hotels, restaurants, schools, in the online classes, what are all. So those are all the things which has to be read rather than how many people are dying around. So that will only, make oneself depressed. So these are some things which one can have a control rather than always looking at things at the macro level. Yes, that has to be done at that level. Whereas at
Yes.
yeah.
I news give us important messages, but at this pandemic, there are lots of rumors, fake news, which is going on in social media, in WhatsApp, in Facebook. So when one excessively sees those messages, automatically there is an anxiety coming in. You worry about it, you fear about it. You at times you get angry about it, how people behave, how people are not maintaining social distances. So it makes you angry. So these can affect you very much. It makes you worried, it makes you angry, it makes you sad. And especially when in the bedtime, not to check on news on COVID, because at times those worries continues. That gives you a sleepless night, because you can't go out of your thoughts. So it's better not to watch towards your bedtime, and not to spend too much time on it. And as Dr. Arvind rightly point out, let's go for something which is reliable information from WHO or Ministry of Health and Family Welfare. So these are some of the place where we can get reliable sources. So this would be really helpful.
So these are the basic certain coping mechanisms that we can take into consideration at our level now that we are stuck due to outbreak, and there are a lot of people. Also, I would like to ask you, though mental health illness is very subjective, doctors, but there have been a lot of studies which show that illness prevails, twice in the capacity of among people who are under poverty line. So how true it is, and how should we address it?
I would say like it is not really like it is more prevalent among persons who are below or who are in the lower socioeconomic status. As it is told, the types of mental illness varies.
Okay.
Severe mental disorders, irrespective of gender, irrespective of the class, it can happen to anyone. Severe mental disorders, when I say, it is about that psychosis what Dr. Kim was talking about. Whereas when it comes to stress related disorders, because as mental disorders, common mental disorders are also related to the socioeconomic status. For example, those who are always in a very low socioeconomic status, they tend to be more sad.
Okay.
And if in that situation, if the social support is also not good, for example, a woman who's living in a low socioeconomic status, where husband is a person who's alcoholic, obviously she has more chances of getting depressed. Also, she has more chances of attempting suicide. So it is just not about the socioeconomic status, it is also the prevailing situations around that particular person which decides a person to have a mental illness or not. There is also a theory called as social vulnerability theory. What does it say? Stress vulnerability theory. What it says is that each one of us has the vulnerability, biologically vulnerability to get mental illness, biological vulnerability, each one of us. But
Okay.
depending on the stress what we undergo. For example, I may not undergo any life event at all, so I may not get mental illness. Whereas someone else who is also vulnerable, but if there are more stresses, they have more chances of getting into mental illness. So that's how we need to look at it, because we treat people who are from higher socioeconomic status, we treat people who are from lower socioeconomic status, as well as we treat people from rural areas, urban areas. So there is no much of difference in terms of the economic status as such.
So I believe at this point of time, staying connected, even staying connected with your family through social networks becomes as important as maintaining a daily routine. And, as Dr. Kim rightly said, exercising regularly and practicing habits that would reduce the stress. So thank you for joining us, Dr. Arvind and Dr. Kim. It was a great session, and I believe our audience will have a lot to take from this. And majorly, that credible information at specific times of the day is very, very important. Thank you for joining us, and we would like to connect with you soon. Thank you.